I chose to get involved in cancer research because of my own personal history with cancer. I'm one of the few people that's lost 3 parents to cancer. When your lived experience informs the work that you do, I think you do it differently. I dispel myths about participation in clinical research probably weekly, if not daily. It's that, am I being targeted? Is this just yet another way for research to be done to me, done on me, and not for me? The other misconception that I hear is a lot of people don't know that an institutional review board exists. They don't know that there's someone out there reviewing every question that's asked in a research project. Your medical mistrust is actually warranted. Your skepticism is warranted. But the fact that we have institutional things like the IRB, the Institutional Review Board, informed consent process, all these things were birthed out of injustices that happened as a result of research that was done the wrong way.
All of these new drugs, we will only know truly how effective they are for our population if that representation is there. And so we really aspire to bring on board a diverse population for trials.
We are able to do lung cancer screenings now as a preventive measure or early detection for lung cancer. That was a result of one of the largest studies that only included 4.5% African Americans and only less than 10% underrepresented minorities in that study. Couple that with the fact that African Americans, particularly African American men, carry the greatest burden of lung cancer disparities. So there's a clear disconnect there.
There are benefits to participating in research that can come back to help you very directly. Trials, are not going to be effective if we don't explore how they're working in all populations and all communities. As a community to bench cancer center, we want to really focus on drug targets that go beyond what a traditional cancer center would do and identify specific needs. We now have an opportunity to up our game in treatment modalities for a diverse population by onboarding clinical trials that are attuned to the needs. For instance, there's some unique signaling pathways that may be more important in African Americans to target than another population. One of the best part of my jobs is really engaging with the patient brigade, the patient activists, and everybody that's working in our community engagement efforts.
When we get findings, we communicate those findings back to the population, and we say, because of you, I'm able to tell this man that we can screen him more effectively for prostate cancer. I would not have been able to do that if you didn't participate in this research study. But because of you, science is better.